Hello everyone, my name is Dr. Irfan Ahmed, working as a medical lecturer in microbiology, virology and immunology department of Samarkand State of Medical University. So today we will discuss about the intestinal infections like salmonella, typhoid, shigellosis, dysentery, dysentery and etc. So we will discuss every topic one by one. So let's move to the first topic is E. coli. So classification of the Enterobacteriaceae. So Enterobacteriaceae is a loose fermenters E. coli, Citrobacter, Klebsiella, Enterobacter, and non-lactose fermenter is Salmonella, Shigella, pertussis, and Yersinia. There are several selective and differential media used to isolate and distinguish between the LF and LNF. The most important are McConkie agar, Eosin methylinase blue agar, Salmonella shigella agar, in addition to triple sugar iron. So morphology is usually motile, produce particular flagella. Some produce polysaccharide capsules, grow well on non-selective media, forming smooth, colorless colony 2 to 3 mm in diameters in 18 hours on the nutrients agar. Temperature is 15 to 45 centigrades. E. coli is morphology is gram-negative straight rods 1 to 3 multiply 0.4 to 0.7 microns appear in single flagella, appear in single or in pair, motile by the patricoate flagella. Very few strain, non-motile, not spore forming, no acid fast. Culture characteristics: there are anaerobes and facultative anaerobes that grow on the simple or ordinary media at the 37 centigrade in 8 to 24 hours. Liquid medium, after 12 to 24 hours of incubation, uniform turbidity is produced. The nutrient agar medium, after 12 to 18 hours of incubation, circular colonies will appear within the 1 to 3 millimeter diameter. The colony will be smooth or colorless. McConkie agar medium, which method is McConkie agar, is inoculated with tastes. Incubation, the plate in incubator at 37 centigrade 24 hours. Result: organisms appear as a pink colonies. E. coli. Blood agar medium, beta hemolysis will occur in the blood and agar medium. Enterohemorrhagic bacteria, E. coli. Pathogenesis: urinary tract infections. The urinary tract is the most common site of E. coli infection, and more than 90% of all uncomplicated UTIs are caused by the E. coli infection. The reoccurrence rate after the first E. coli infection is coli infections. The reoccurrence rate after first E. coli infection is 44 over the 12th month. E. coli cause a wide range of UTI including uncomplicated urethritis, cystitis, symptomatic cystitis, polynephritis, and acute prostatitis and prostatitis abscess and urosepsis. The enteric infection, as a cause of enteric infection, 6 different mechanism of actions of the 6 different varieties of the E. coli has been reported. The enterotoxogenic E. coli is a cause of the traveler diarrhea. Enteropathogenic E. coli is a cause of the childhood diarrhea. Enteroinvasive E. coli cause the Shigella-like dysentery, and enterohemorrhagic E. coli cause the hemorrhagic colitis and hemolytic uremia syndrome. The other infections, the other miscellaneous injections are E. coli infections include septic arthritis, endoophthalmitis, suppurative thyroiditis, sinusitis, osteomyelitis, endocarditis, and skin and soft tissue infections, especially in patients with the diabetes. The lab diagnosis, the hematological investigations within normal limits in the early stage of the disease, the bacteriological investigations, microscopic studies, culture studies, biochemical studies, agglutination test. The microscopic studies, after gram staining, it will show the moderate to the large number of the gram negative bacilli containing the pus cells. The culture studies, is a blood agar medium or McConkey medium is used for the culture of the E. coli. After overnight incubation at 37 centigrade, at the medium will show the pink circular or convex colonies. The biochemical studies, sugar fermentation test. The sugar fermentation test, the fermentation of the lactose will occur the production of the gas. Motility test, positive. Indole test, positive. MR test is a positive. VP and citrate is a negative. Agglutination test is isolated colonies from the blood agar medium or the McConkey agar medium are the further treated with the specific antiserum. The clotting of the medium will occur. The treatment is antibiotics generally are not recommended because they can increase the risk of the serious complications. If you have the serious E. coli infections that has caused hemolytic uremic syndrome, if you will hospitalized and given supportive care including IV fluids, blood transfusions and kidney dialysis. So next disease of the intestinal system is salmonellosis. Salmonella is a bacteria that make the people sick. It was discovered by an American scientist named the Salmon and has been known as to cause the illness for over 125 years. Salmonella, the name of the group of the bacteria, is one of the most common cause of the food poisoning in the United States. 1.2 million illness and approximately 450 death occur due to the non-typhoid salmonella annually in the United States. In an infection with salmonella, the bacteria usually affect the gastrointestinal system, the stomach and intestine in humans. In more severe cases, salmonella can spread to the blood, the bones, and even the fluid around the brain, but these type of infection are less common. The Daniel Salmon 1850 to 1914 gram-negative bacteria, more than 2500 survivors and serotypes, many are zoonotic. This species is Salmonella bengori, Salmonella is enterica, and 6 subspecies. History. The history is the first isolated in 1884. The cholera seals in a pig intestine. The prevalence in the US estimated 1.4 million cases per years. Only 40,000 culture confirmed. Geographic distribution worldwide related to the animal husbandry. Widely reservoir. Sir, our distribution varies. Some geographical limitations. X subtyping of Salmonella paratyphi is isolated from the India and Pakistan and Indonesia and Malaysia. Eradication program in some countries, Sweden, US serotypes 2009 intratitis, typhimurium, Newport, Javiana, Hellenberg, Montevideo, Munich, and prevalence in animals is 80-60%, 50% in chicken, 1 to 3% in dog, 2 to 20% in horse, and 6% in buffalo or cow. Human transmission, fecal-oral route, direct or indirect. Commonly contaminated items is meat, eggs, and water. The fecal material from the reptiles, chicks, duckling, livestock, dogs, cats, adult poultry. So pathophysiology is a bacteria colonize in the ileum, the ending part of the small intestine. They invade the intestinal epithelium. They expand within the epithelium and lymphoid cavities. The invasion happens even the organisms start to ruffle. This way they stimulate the pinocytosis. They multiply and spread through the mesenteric lymph nodes. After reaching the intestine, they create an acute inflammation. Classification. Two broad classification. Non-typhoidal salmonella carry the both humans and animals, and X Salmonella javiana and Salmonella enteritis. The typhoidal salmonella is carried only by the humans and X Salmonella typhi. The salmonellosis non-typhoidal. Infectious agent is Salmonella enterica, subspecies enterica. Epidemiology is leading cause of the bacterial diarrhea worldwide. 94 million cases of the gastroenteritis and 1,15,000 deaths globally each year. 7.1 cases per 10,000 among the travel to the Latin American and Caribbeans. The major contributors of the reported cases in travelers: Mexico, India, Jamaica, the Dominican Republic, the China and Bahamas. The clinical presentation is an incubation period is 6 to 72 hours, but illness usually occur within 12 to 36 hours after exposure. The symptoms is acute diarrhea, abdominal pain, fever, vomiting, headache, fever chills, myalgia, severe dehydration, infant, elderly. The illness usually lasts 4 to 7 days and most people recover without the treatment. The rate of invasive infections and death are generally highly among infants, older adults, and people with immunosuppressive conditions including HIV, hemoglobinopathies, and malignant neoplasm. Diagnosis is based on the isolation of the Salmonella organism. About 90% of the isolate are obtained from the routine and the stool culture, but isolate are also obtained from the blood and urine and material side from the infection. The isolate of the Salmonella are the need for the serotyping and antimicrobial susceptibility testing. The treatment is Uncomplicated salmonella infections with the supportive therapy and no antimicrobial agent. Antimicrobial therapy should be considered for the patient who are the severely ill. The fluoroquinolones, azithromycin and rifaximin are also commonly used. Resistance and antimicrobial agent varies the serotype and geographic regime. Resistance to older antimicrobial agent, chloramphenicol, ampicillin, and trimethoprim sulfamethoxazole. Resistant to the both fluoroquinolones and third generation cephalosporins has increased. The prevention, foodborne disease, avoid raw or uncooked eggs, poultry meat, unpasteurized milk, wash food before the eating, wash food before eating, avoid cross the contamination of food, keep uncooked and cooked food, wash hand and kitchen tools, do not feed infant or change diapers while the handling the foods. Mother milk is the safest food of the young infant. Breastfeeding prevent the salmonellosis and many other health problems. So animal contact, wash hand after contact. If immunocompromised, avoid the contact with the reptiles, young chicks and ducklings reptiles. Wash hand cages and surfaces. Change cloth after animal contact. Do not allow the reptiles to roam freely. Salmonella control the program in Denmark. Salmonella control the program of the broiler chicken, layer beans and pigs in the Denmark. Major reduction in the incidence of the foodborne human salmonellosis and occur by the four integrated control of the farm and the food poisoning process. These salmonella testing under the Nation Control Program UK. This program was implemented in the UK on the 1st February of the 2008. It required that from the 1st January 2009, eggs originate from the flocks infected with the Salmonella intradidus or the Salmonella typhimurium cannot be sent to the human consumption unless treated in a manner which the guarantee the elimination of the Salmonella. The next is typhoid fever. The typhoid fever is a result of the systemic infections, mainly Salmonella typhi, found in the man. This disease is clinically characterized by a typical continuous fever for the 3 to 4 weeks. The relative bradycardia with involvement of the lymphoid tissues and considerable constitutional symptoms. The term enteric fever includes the both typhoid and paratyphoid fevers. It may occur sporadically, epidemics or the endemically. The typhoid fever is the result of the systemic infections, mainly by the Salmonella typhi, found only in the man. The agent is the Salmonella typhi is a major cause of enteric fever. The Salmonella para A and S para B are the relatively infrequent. Salmonella typhi has three main antigen OH and 6 and number of the phages type at least 80. The Salmonella typhi survives the intracellularly in the tissue of the vibro organs. It is readily killed by the drying, pasteurization and commonly in disinfections. The reservoir of the infection, human is only reservoir of the infection case. This case may be mild, mixed or the severe. The case or the carrier is infectious as long as bacilli and appear in the stool or the urine. The carriers temporary, incubatory, convalescent or the chronic. The convalescent carriers excrete the bacilli for the 6 to 8 weeks. The chronic carrier excrete the bacilli for the many millions. Was the cooked in Oyster Bay, New York. Source of infection. The primary source of infection are the feces and urine of the cases of the carriers. The secondary source contaminated water, food, fingers or the flies. The host factors: age, highest incidence in the 5 to 19 years of the age group. Sex, more in males than female but carrier rate more in female. Immunity, all age are the susceptible to the infection. Antibody may be stimulated by the infection or by the immunized. The antibody to the somatic antigen is usually higher in the patient with the disease, and the antibody to the flagellar antigen is usually higher in the immunized individual. Environmental factor is a peak incidence in the July-September. Outside the human body, bacilli found in water, ice, food, and milk and soil. Water survive for the 7 days. Ice and ice cream survive over the month. Soil survive up to the 7 days. Food multiply and survive for the sometimes. Milk growing rapidly. Vegetable grow in a savage form. Typhoid fever may be therefore be regretted as a index of incubation period. Usually is a 14 days, but it is may be the short as 3 days or as long as 3 weeks depending upon the dose of the bacilli ingested. Mode of transmission: typhoid is transmitted via the fecal oral route or the urine oral routes. This may take place directly through the soiled hand contaminated with the feces or the urine of the cases or carriers, or indirectly by the ingestion of the contaminated water and milk. The clinical feature is malaise, headache, cough, sore throat, often with abdominal pain and constipation. The fever ascends in the stepladder fashions. After about the 7 to 10 days, the fever reach to the plateau and the plateau look the toxic. The appearing exhausted and often prostrated. There may be made constipation, especially in the early stages, or the pea soup diarrhea. The latter splenomegaly, abdominal distensions, and tenderness, relatively bradycardia, dichrotic pulse, and occasionally meningitis appears. The rash, rose spot, commonly appearing during the second week of the disease. The serious complication occur up to the 10% of the typhoid fever patient, especially in those who have been ill longer than the 2 weeks and who have not received proper treatment. Intestinal hemorrhage is manifested by a sudden drop in a temperature and sign of the shock following by the dark and fresh blood in the stool. Intestinal perforation is most likely to occur during the third week. Less frequent complications are urinary retention, pneumonia, and thrombophlebitis. Laboratory diagnosis: microbiologically procedures is a blood culture. Serological procedures is a Flexis Vidal test. New diagnostic test is ideal tubex, TIBBIYOT, TIBBIYOT-M, TIBBIYOT rapid, IgM dipstick test. The control of the typhoid fever is the control of reservoir, control of the sanitation, and immunization. The control of reservoir means early diagnosis by the culture of the blood and stool, notification where it is mandatory, isolation until the 3 bacteriologically negative stool and urine report. Treatment is the fluoroquinolones, drugs of the choice, disinfection of the stool urine by the 5% creosotes for the 2 hours and soiled cloth by the 2% of the chlorine. Follow-up examination of the stool and urine should be done for the Salmonella typhi, and 3 to 4 months after discharge of the patient, and again 12 hours or 12 months to prevent the development of the carriers. The identification by the culture and serological exams. Treatment is intensive course of the ampicillin or amoxicillin with the probenecid for the 6 week. The surgery cholecystectomy if needed, kept under surveillance. They should be the prevented from the handling food, milk, water for the others. Health education regarding the washing of the hand with soap after defecation or urination and before the preparing of food is an compulsory. The control of the sanitation. Essential measures of the interruption transmission of the typhoid fever are protection and purification of the drinking water supplies, improvement of the basic sanitation, the promotion of the food hygiene, immunization. Immunization is recommended to those living in endemic areas, household contact group at the risk of the infection such as school, children and hospital staff, travelers proceeding to the endemic areas, those attending the meals and yatris. Anti-typhoid vaccine is V polysaccharide vaccines and TY21 vaccine. Anti-typhoid vaccine is V polysaccharide vaccines, subcutaneous IMs, not for less than 2 years, only one dose required. The protection after 7 days, revaccination every 3 years. TY21 a vaccine oral not for 3 days. Alternated days is 1357. Protection after 7 days. Reactivation every 3 years. Live attenuated. Remember oral typhoid fever vaccines. Day 1, 3, 5, 7. So next disease is the cholera. Define cholera is the state epidemiology of the cholera. Describe the causative organisms which is the learning objects. Explain the pathophysiology of the cholera. Mention the sign and symptom of the complication, risk factors, cause, diagnose, treatment and prevention and prognosis of the cholera. Describe the way of controlling the spread of cholera. Cholera is an acute diarrheal illness caused by the infection of the intestine, which is bacteria called the Vibrio cholera. Cholera was prevented in 18th century, but due to the proper treatment of sewage and drinking water has become the more rare in developed countries. Cholera is a fecal disease, meaning it that spread when the feces of an infected person come into contact with the food or the water. Incidence 1 in 1000 worldwide. Over 1 million cases, nearly the 1000 or 10,000 fatalities. Vibrio cholera gram negative type of the gram protective bacteria. Distinguished factor is oxidative positive and motile via the polar flagellum and both respiratory and fermentive metabolism. Organism can multiply freely in the water. Pathophysiology of the cholera. Vibrio cholera accumulate in the stomach, increase cyclic AMP, activation ions and channels, produce the toxins. G protein seeds on the positioning. Toxin will bind to the G protein and inactivation of the GTPs lead to the watery diarrhea. Sign and symptoms. Most people remain the asymptomatic. The symptom of the cholera include profuse watery diarrhea, stomach pain, legs pain, mild fever, vomiting, sunken eyes, dry mucous membrane, decreased urinary output. Complication is a severe dehydration, shock, renal failure and death. This factor is a poor sanitary condition, raw of uncooked food, hypochlorhydria, means people with a low level of the stomach acid, such as children, older adults, and some medications. Type of O blood types. Reasons are not really clear but twice more likely. Cause transmission: food is drinking contamination of water, eating raw or uncooked food of the shellfish. Diagnosis is a clinical diagnose and differential diagnose. Clinical diagnose is a cholera should be considered in all cases with severe watery diarrhea and vomiting. Traveling to the affected area that eaten shellfish not distinguish clinically manifestation for the cholera. The differential diagnosis is enterotoxins, coli, bacterial food poisoning, viral gastroenteritis. Laboratory diagnosis is a culture in which organisms are motile, appear like a shooting stars. Microscopy show the sheet of the curved gram-negative rods. Vibro often detected by the dark field and the phase contrast microscopy of the stool. The laboratory diagnosis is additional method of the detection include the PCR and the monoclonal antibodies based stool test. Treatment is oral rehydration salt, intravenous fluids, ringer lactate, the antimicrobial therapy, which is fluoroquinolones. Prevention: basic health education and hygiene, mass chemoprophylaxis, prevention of the safe water and sanitation, comprehensive multidisciplinary approach, water, sanitation, education, and communication. Vaccination is a prenatal vaccines, killed vaccines, and live attenuated vaccines. The prognosis the prognosis of the cholera can range depending on the severity of the dehydration and how quickly the patient is given and responds to the treatment. The death mortality rate is untreated cholera can be high as 50% to 60% during large outbreaks but can be reduced to the about 1% of the treatment. Protocols are rapidly pure into the action. Controlling cholera: treatment centers set up the treatment centers for the prompt treatment, sanitary measures, food safety, and animal health measures. Adapt to each situation for a comprehensive multidisciplinary approach. The bacillary dysentery, which is shigellosis. The table of contact we will study in this PDF is a PPT: introduction, epidemiology, causative agent, clinical features, diagnosis, treatment, and prevention control. The first is introduction. Bacillary dysentery is an acute bacterial disease involving a large and small intestine. It can by the bacteria with the genus Shigella, of which is dysentery type 1 cause the most severe disease and large outbreaks. Outer space include the flexneri and suneri and bodily. It is the most important cause of acute bloody diarrhea. Epidemiology: the shigellosis caused an estimated 150 million illness and 14,000 death worldwide. Endemic in both tropical and temperature climate. The S. dysentery type 1 is concerned to the developing country and spread in emergency situation and outbreak can occur. These Salmonella Suneri most common neutralized industrialized countries where the disease is generally less severe. Causative agent is the Shigella strain gram-negative, facultative anaerobic non-motile rod and classified in the family of Enterobacteriaceae. Shigella strain can dysentery by the invading the destroying the cells that lining in the large intestine. There are four subgroup of the Shigella. The Salmonella dysentery, most severe infection due to the Shigella toxin type 1. The Shigella flexneri, Shigella body, and Shigella soni. Group A, B, C are the further subdivisions is 1, 15, 8 and 19 serotypes respectively. Mode of transmission. The only significant reservoirs in human, mainly by the direct or indirect fecal oral transmission from the symptomatic patient or short-term asymptomatic carriers. Infection may be occur after the ingestion of contaminated food or the water as well as a person to person. Infective dose can be low as a 100 to 10 to 100 grams. Water and milk transmission may occur as a result of the direct fecal contamination. Flies can transfer organism from the latrines to the uncovered food items. The incubation period is 1 to 3 days but may range from the 12 to 96 days. Hours up to the 1 weeks for S. dysentery. Clinical feature acute loose stool and small volume accompanied by the fever, nausea, vomiting, toxinemia, vomiting and cramps and tenesmus. In typical case, stool contain the blood and mucus resulting from the mucosal ulceration and confluent colonic crypts, micro abscess caused by the invasive organisms. Many cases present in the watery diarrhea. Mild and asymptomatic infections occur. Illness is usually self-limiting, lasting on average for 4 to 7 days. Case fatality rate can be up to the 20% even with hospitalization. Differential diagnose. Other causes of the dysentery include Campylobacter jejuni, enteroinvasive E. coli, Salmonella, Enteroamoeba histolytica. The complication high risk patient include the children under the 5 years, severely malnourished the patient, elderly over the 50 years. The complication include the sepsis, rectal prolapse, hemolytic uremic syndrome, convulsions. Shigella bacillus is associated with the toxic megacolon, intestinal perforation and human husk. The period of the compatibility during acute infection and until the infection agent no longer present in the feces, usually within the 4 weeks after the illness. Asymptomatic carriers may transmit the infections. Rarely, the carrier state may persist for the months to the longer. The appropriate antimicrobial treatment usually reduce the duration and the carriage of the few days. The diagnosis, isolation of the Shigella from feces or the rectal swab provide the bacteriological diagnosis. Blood is observed in a fresh stool specimen. Stool specimen should be processed rapidly because the Shigella remain viable only for the short period of the time. Infection is usually associated with a large number of the fecal leukocytosis detected throughout the microscopical examination of the stool. Mucus stained with methylene blue are the grams. Isolated specimen should be tested in antimicrobial susceptibility. No rapid diagnostic test for antigen assay are available yet. Case management. Refer seriously ill or severe malnourished patient to the hospital immediately. Check the result of the antimicrobial sensitivity test with the laboratory. They give antimicrobial effective against the Salmonella dysentery and strain promptly all the patient preferably as an inpatient. Treat dehydration with oral dehydration salt or the intravenous fluid if severe. If the antimicrobial use are effective, clinically improved should be noted within the 48 hours. Azithromycin and ceftriaxone may also be considered for the treatment of the shigellosis, especially in the children. The use of anti-motility agent discouraged as a prolonged duration of illness. Whenever feasible, it contact should be discouraged from the handling food carrier of the children and the patients until the diarrhea stop and stool culture is negative in one or more success test taken 24 hours apart and 48 hours after discontinuation of the antibiotics. Throughout hand washing after the defecation, before food handling and carrying the children, patient is essential. Investigate the water and food source and recreational water source using the general sanitation measures. Prevention and control, health education regarding the hand washing and sanitary measures. No prophylaxis, no vaccines. Special consideration is a report to the health authorities. Common source of water and food-borne outbreaks. Shigella bacillus is a potentially problem in the disaster situation. So environmental situation is deficient. So thank you very much for your attention. And references is WHO manual control the communicable disease and communicable disease control the manual 2012 and Ministry of Health. Goodbye to all and we will meet in some another video.